Hi, this is Garippa, and this is my reflection on Interview of a Leader. I chose to interview Dr. Michael Evans. He's a PhD at Eastern University and Assistant Director of Urban School Service Department of Association of Christian Schools. He's also Associate Professor in Urban Studies Department at Eastern University and a board member at Lincoln Leadership Academy Charter School, where I'm employed. I met Dr. Evans several years ago while he was working on expanding some of his leadership techniques, and so came to our school to do professional development with some new staff. He led several meaningful professional developments, some of which I learned from and some of which I questioned the validity. Because of this, I thought it was a great reason to interview him, since I thought I may have to suspend my voice of judgment in order to understand his point of view. Honestly, during that professional development, there were moments when I thought he was all theory and no reality, and I would have no ability to apply any what he was saying to me into practice. Since the time that I scheduled the interview, he has been brought back on to our team, and it changed the dynamic of the interview slightly, and I addressed this in the reflection piece of my presentation. The interview occurred on February 15th at 2 p.m. It was conducted in the staff conference room at Lincoln Leadership. When the interview was scheduled, as I noted, Dr. Evans was a former administrator at Lincoln in the form of professional development and current board member at Lincoln. However, due to an emergency situation, he has taken an interim position overseeing our dual enrollment program at Lincoln Leadership. I wrote down some observations from the interview with Dr. Evans. I am a behavioralist first. This is what I did before I actually became a teacher. And I think that observation is a part of listening skills that many people, including myself, tend to miss when we think about listening. So I wanted to make sure that I made note of these because I think it changes the dynamic of a conversation, especially in an interview when people are nervous or trying to choose words instead of being honest. So I made sure I videotaped the interview so that I could reflect back, but I also made notes through the conversation. One of the things that I've noticed is that Dr. Evans is extremely reflective when he's answering a question. For instance, when I would ask a question, Dr. Evans would write out the question as I said it, sometimes even asking me to repeat it so that he had the question fully written out. Then he would take time to ponder an answer, make himself notes about how he wanted to answer it, and then answer the question. It really displayed that he was listening to what I was saying, thinking about how he wanted to answer it, and then answer the question. It showed that he was listening to me, that he was valuing what I was saying before just shooting from the hip and giving me an answer. It really made me feel valued, and I think it made me able to open up to him. And then if I mimicked that behavior back at him, he then responded the same way by opening up and giving me further answers. My first reflection in the U is that Dr. Evans lives in the U. I think just naturally this is how he responds to conversation. He quickly allows conversation to move down the U past downloading into a place where you become collaborative in everything that you're talking about. It's almost as if every moment is so vital and important that you need to be present in it and speaking from this very open and honest place. It's almost unfair that I chose him because he exists in this place where he's always listening and sensing the other person's feelings and where we can move from here. Because he allowed the conversation to move past downloading, he was able to sense the real purpose and able to reflect and share details that perhaps someone who is more data-driven or more fact-driven wasn't able to share in an interview. And in that case, I was really able to stay in a very low section of the U for most of the interview. Some insights into Dr. Evans' leadership. Although his current role at Lincoln is unclear at the time, he realizes his focus is always on the students and places most of his importance there. In fact, several questions when I asked him about his leadership at Lincoln or where does he see his position leading, it always came back to student and student success. He's very soft-spoken, but he's so powerful in the words that he chooses to use. He speaks often about using head, heart, and hands. And this was before we actually got to that part of Theory U where I kind of made that connection like, oh my goodness, he really is using the same words that we were reading about in the book. Dr. Evans also believes in direct communication and recognizes the importance of tone in effective leadership communication. He also values collaboration in team communities and sees little sense in wasting time and effort of valuable staff members. He's passionate about nurturing our youth, especially in at-risk populations, but is not afraid to take that firm stance when needed as a leader, and sometimes almost takes on a parental stance, where he almost sounds more like a parent when it comes to addressing the needs of the students. Now, all of this being said, he's no nonsense in his actions, and he doesn't mince words in dealing with the issues. When asked how a leader responds to team members that aren't performing, and this really has to do with the insight that I wrote about tone, I asked him, how do you deal with team members that aren't responding to the team? His answer was, I can plead like a child, which I am not. I can scold like a parent, which I am not. Or I can talk like an adult. And if they can't respond like an adult, then they need to evaluate their presence on my team. And I thought that was incredibly powerful because you're really giving back the ownership of a person's behavior. And I thought this was wonderful, and it's something that I really want to relate into my own leadership development because I think it's somewhere where I have difficulty, where I'm almost become pleading. I go through those stages where I'm pleading and then I'm scolding, and I'm missing that place where I'm giving back the ownership to someone who isn't acting like a valuable team member. Some reflections from the interview. In the case of interviewing Dr. Evans, it was easy to move into the lower levels of the U. Dr. Evans naturally connects at this level and listens or questions to encourage the type of conversation that leads to collaboration. Reflecting back now, I realize that I remember his emotional reaction to questions more than I remember the exact answers. In fact, I had to go back and watch video and listen to audio to remember what he said, but I can remember his face or his body language. The behaviors are also important to note when sensing and presencing as an interviewer, and I think this is something that we miss. In the U, my reflections in the U, there was a collaboration story that I did want to talk about. I asked about a time when Dr. Evans actually felt as if his team really came together and a time that he would like to replicate. And the story he told me was almost something that you would read in the Theory U book. And he discussed about how he had created a multi-level professional development where experts came in, presented their work, and then left a meeting, where people flowed in and out, only staying when they needed to, making the most of their time and valuing their time. And he spoke of how there were no set leaders and how everyone shouldered the work, and yet there were no huge undertakings, but there was a tremendous success. And we both leaned in. So we both came closer together, pens down, totally engaged in this story. And then after the story, there was a pause because nobody wanted the story to end. Nobody wanted to kind of ruin the beautiful collaboration that was happening in this story. Before I asked, how do you see this happening here? And then that conversation turned into the sideline of collaboration for our own school. This was one of the many instances where we began crystallizing work at our own school. And it did sideline the interview often when we did this, but it was such a powerful moment that it was really hard not to take it and embrace it, because that was the whole natural movement through the U. And I didn't want to disrupt that and pull us back into the interview and take away from what was naturally happening. So I tried to let it happen a little before pulling us back in to the interview, because I didn't want to ruin what was happening just organically. As far as accessing my open mind or my voice of judgment, I did need to practice this on several occasions, as I didn't completely agree on some of the items that were related to work. And I needed to remind myself that this wasn't a work meeting at times, especially when it comes to student success and how it relates to teacher burden. So it's really hard to suspend that voice of judgment. The other thing is that with an open heart, there is a difference between open heart and losing heart. And I think at one part of the interview, I was so enamored by a personal story that I began to lose focus. And I realized that I need to maintain myself in an interview, which is a reflective piece I need to work on in future interviews. That's not something that's new. I know I tend to lose focus, and so that's a skill that I do need to work on, because that's something that's not going to go away. Now, due to Dr. Evans' new role in the U, we were sidetracked, like I said, many times. But during these reflections into the talks, and we did move into what was happening at the school, what needed to happen, how we can change things, and that is that crystallization process and that movement towards the uptick in the U. I did redirect back into interview mode when I felt that it was appropriate, and I didn't want to not honor the natural movement, so I tried to give him time to speak and think and write things down about how he wanted to move in the future before I moved back into interview mode. Reflections on my own leadership development and suspending my point of view. Listening and observation is very powerful. I really feel as if listening is not just about using our ears, but it's also about using our entire body language. If I wasn't as receptive in the interview as I was with not just, my face, but my body language, that I wouldn't have been able to get, especially during the collaboration story, as much sharing from Dr. Evans as I did. He was willing to think about recreating a very special moment in his time, in his life, in his leadership development with me. So that came from my entire reflection, like how I was reflecting his feelings. And so that wouldn't have happened if I wasn't listening in a place where he felt safe. And I think that listening and observation is very powerful in that. And I really want to continue to work on that, but do it in a way that it seems authentic, so that people don't believe I'm just humoring them. I think that Dr. Evans and I, because we have a relationship, a prior relationship before, that didn't happen. But I need to make sure that with strangers, that also is an honest listening behavior. Open mindfulness is a muscle that requires constant exercise. I think that that's something that I also need to work on, especially with my voice of judgment. I know sometimes when we walk into an interview and you're looking at a bio or a resume, sometimes you walk in and you already have a mindset that you're carrying with you. And so it's a muscle that we have to practice putting down and being mindful of the fact that things may change based on what we're hearing, what we're seeing, and what we're observing. And that open heart does not require loss of self. And that we need to make sure that we're not captivated by someone's charisma, which I know I can fall into. So that's also an exercise that I need to work on in my leadership development. I thank you for your time, and I hope you enjoyed my reflections of my interview with Dr. Evans. Thank you.